Hello everyone, this is Dr. Sam and this video is about ectopic pregnancy ultrasound reporting. You will learn how to write ultrasound reports regarding ectopic pregnancies. The reports will include clinical history, procedure, findings, and the impression. Our first example is of tubal ectopic pregnancy. Clinical history, abdominal pain, positive pregnancy test, suspected ectopic pregnancy. Procedure, transvaginal ultrasound examination was performed. These are the findings. Uterus. The uterus appears normal in size and echo texture. The endometrial cavity is empty with no evidence of an intrauterine gestational sac. These are the findings in the adnexa. Right ovary, normal in appearance with follicular activity observed. Left adnexal region, an irregular non-cystic mass adjacent to the left ovary measures approximately 3.5 into 2.6 centimeters. The mass exhibits a heterogeneous echo texture and is consistent with a tubal ectopic pregnancy. No free fluid is noted in the cul-de-sac. Right fallopian tube appears normal. Left fallopian tube. The mass in the left adnexal region appears to be associated with the left fallopian tube, suggesting a tubal ectopic pregnancy. There is no evidence of rupture. Cervix and vagina appear normal. This is the impression. Findings are suggestive of a left tubal ectopic pregnancy. No evidence of intrauterine pregnancy or rupture. Immediate medical evaluation is recommended. Follow-up with referring physician for management of suspected ectopic pregnancy is advised. Monitor HCG levels and consider repeat ultrasound if clinically indicated. This is a report for interstitial ectopic pregnancy. Clinical history, delayed menstruation and intermittent pelvic pain. These are the findings. The uterus appears normal in size and echo texture. The endometrial cavity is empty with no evidence of an intrauterine gestational sac. The right ovary is normal in appearance with follicular activity observed. The left ovary is normal in appearance with no abnormal findings. The right fallopian tube appears normal. Left fallopian tube. The interstitial segment of the left fallopian tube, which is the part of the tube that passes through the uterine wall, shows an abnormal gestational sac-like structure measuring approximately 2 into 1.8 centimeters. The structure exhibits a thickened echogenic rim and contains a yolk sac and a visible fetal pole measuring approximately 6 millimeters, consistent with an interstitial ectopic pregnancy. No free fluid is noted in cul-de-sac. Here is the impression. Findings suggestive of a left interstitial ectopic pregnancy with a visible fetal pole. No evidence of intrauterine pregnancy or rupture. Immediate medical evaluation and management are recommended due to the potential for rupture and significant hemorrhage. Urgent follow-up with the referring physician for management of suspected interstitial ectopic pregnancy is advised. Close monitoring of HCG levels and possible additional imaging to further assess the condition is warranted. Now we have a report for cervical ectopic pregnancy. Clinical indication: Positive pregnancy test accompanied by irregular vaginal bleeding and mild pelvic discomfort. These are the findings in the uterus. The uterus is normal in size with an empty endometrial cavity. No intrauterine gestational sac is observed. Cervix. There is a gestational sac-like structure within the cervical canal, measuring approximately 2.5 into 2 centimeters. The sac is eccentrically located and contains a yolk sac and a fetal pole measuring approximately 7 millimeters. There are no signs of active bleeding or rupture within the cervical region. The cervical os is closed. The right ovary appears normal with follicular activity. The left ovary is normal. Fallopian tubes. Both fallopian tubes appear normal with no signs of ectopic pregnancy. Cul-de-sac, no free fluid or significant hemorrhage noted. This is the impression. The findings are suggestive of a cervical ectopic pregnancy. There is a visible gestational sac with a yolk sac and fetal pole located within the cervical canal. No intrauterine pregnancy or abnormal masses are noted. Immediate consultation with an obstetrician or gynecologist is advised for further evaluation and management of the suspected cervical ectopic pregnancy. Monitoring and follow-up imaging as deemed necessary by the obstetrician or gynecologist. Now we have a report for ovarian ectopic pregnancy, clinical history, recent positive pregnancy test, acute onset of unilateral pelvic pain. These are the findings. The uterus is normal in size with an empty endometrial cavity. No intrauterine gestational sac is observed. These are the findings. Right ovary appears normal with no evidence of corpus luteum cyst or abnormal mass. Left ovary, there is a complex adnexal mass adjacent to the left ovary, measuring approximately 3 into 2.5 centimeters. Within the mass, there is a gestational sac-like structure. The left ovary is partially visualized and appears distinct from the mass. The right and left fallopian tubes appear normal. The cul-de-sac has minimal free fluid. Here is the impression. Findings suggestive of a left ovarian ectopic pregnancy characterized by a gestational sac-like structure adjacent to the left ovary, the absence of an intrauterine pregnancy, and a distinct mass associated with the left ovary support this diagnosis. Immediate referral to an obstetrician or gynecologist for further evaluation and management is recommended. Consider serial HCG measurements and follow-up ultrasound to monitor the progression or resolution of the ectopic pregnancy. Prepare for potential intervention due to the risk of ovarian rupture and hemorrhage. This is a report for heterotopic pregnancy. It is very rare. Clinical history, positive pregnancy test, experiencing mixed symptoms of pregnancy along with unusual pelvic pain and spotting. These are the findings. Uterus, an intrauterine gestational sac is present, measuring approximately 3 centimeters in diameter. It contains a yolk sac and a fetal pole with a brown rump length of approximately 6 millimeters. Cardiac activity is detected in the intrauterine fetal pole. The endometrial lining is appropriately thickened for early pregnancy. Cervix, A separate gestational sac-like structure is visualized within the cervical canal, measuring approximately 2.8 into 2.5 centimeters. This sac contains a yolk sac and a small fetal pole, but no cardiac activity is detected. The structure is distinctly separate from the intrauterine sac. The right and left ovaries are normal. The right and left fallopian tubes are normal as well. Pelvis sac, minimal free fluid is present. No additional abnormalities detected. Here is the impression. The findings are indicative of a heterotopic pregnancy characterized by the coexistence of an intrauterine pregnancy with a viable embryo and a separate gestational sac within the cervical canal, suggestive of a cervical ectopic pregnancy. The lack of a cardiac activity in the cervical gestational sac is noted. Immediate and careful consultation with an obstetrician or gynecologist is recommended for further evaluation and specialized management. Considering the rarity and complexity of this condition, careful monitoring of the patient's condition is advised, including serial HCG measurements and follow-up ultrasounds as directed by the obstetrician or gynecologist. Thank you so much for watching. Please subscribe and stay tuned for more imaging videos.